The Oxford Health Arts Partnership, the OHAP, is the arts programme for the Oxford Health NHS Foundation Trust. The partnership involves a multi-talented team of freelance artists and volunteers. And bringing all these visions to life are two part-time members of staff, Angela and Tom. The OHAP was established in Oxfordshire in 2006 and expanded into Buckinghamshire. Today, it works with children and adolescents, adult and older adult mental health services. In more recent years, since 2017, the OHAP has worked in community hospitals across Oxfordshire, as well as learning disabilities services and recovery colleges. Many of the team's projects are funded by the Oxford Health Charity, the NHS charity, which supports the Oxford Health NHS Foundation Trust. The OHAP is working on 5 key themes which lie at the core of a 3-year strategy: to understand, produce, inspire, grow and research. Over the past few years, the evidence has grown, showing the undeniable impact of art in healthcare settings, and this growth isn't slowing down. Nationally, the NHS and social care are beginning to embrace the significant role that creativity plays in promoting health and well-being. Evidence has shown that longer-term patients report feelings of isolation and detachment, leading to boredom, anxiety, and lethargy. These emotions increase stress levels, which can hamper a patient's recovery. Having engaged patients, especially through arts programs, helps them feel hopeful and happier, meaning they get better and go home quicker. The OHAP team delivers an arts program that includes all art forms, from dance to music to drawing, painting and mosaicing, using co-production. Art is a great way to distract the mind from intrusive thoughts. It explores ideas and concepts in a safe way. Participatory workshops demonstrate how art can help people's well-being, mental health and model positive behaviour. Art projects are co-produced with staff, patients and a host of key individuals and groups as a direct result of the OHAP. A shining example of an exciting collaboration includes Oxford University's Gardens, Libraries and Museums Division, also known as GLAM. Exposure to culture can aid a person's recovery and help deliver one of GLAM's core aims. GLAM offers exciting and memorable object handling workshops in both mental health and community wards across Oxfordshire. The OHAP delivers short courses for adults accessing the Early Intervention Service, the EIS. Health and social care professionals at the EIS work alongside patients to support and reduce the problems of experiencing psychosis for the first time. Online and face-to-face courses give people the chance to get together and share artwork in a safe space. EIS groups have been exploring the wonderfully diverse Pitt Rivers and Natural History Museum in Oxford with the support of GLAM. The OHAP uses art to inspire people and aid their recovery across all Oxford health sites. The Warnford Hospital is one of the oldest working buildings in the NHS. It has beautiful grounds, a large meadow and apple orchard that are enjoyed and cherished by patients and staff. The Warnford Gallery is a space for service users and staff to display original artwork and showcase thought-provoking community projects. Work by local artists with a connection to the hospital also features in this space. The Highfield unit in Oxford is a state-of-the-art NHS facility providing specialist inpatient services for young people with acute mental health needs. The unit features beautiful stained glass windows, a patterned floor, photographs and mosaics that are impactfully designed in partnership with young people and the OHAP. The Meadow unit, currently being built, is a new psychiatric intensive care unit for young people based at the Warneford Hospital. The OHAP is working alongside young people and artists to co-design artwork to enhance the new building. Everyone has had their opportunity to bring their own vision and thoughts, with lots of consultation about colours, textures and fittings. This beautiful mosaic will stand with pride at the front entrance. The unit will also have bespoke artwork built into the walls and gardens to make it peaceful and comfy, a place to help aid recovery. The green spaces around the hospital are vital areas. They help to improve people's experience of the hospital as well as their mental health. Murals for children in the waiting and clinical areas in minor injuries units have been designed with staff to help reduce anxiety and stress for both children and parents. Artwork co-created for older patients in community hospitals helps to reduce anxiety and stress. Creative, bright and bold colours on display are especially designed with dementia patients in mind. Saffron House in High Wycombe is a new community mental health hub for Buckinghamshire. It was co-created with people who use mental health services as well as the staff in South Buckinghamshire. Sustainability is at the heart of this space. The OHAP transformed the outdoor space at Saffron House. Working with the Chiltern Rangers, a local conservation group focused on education and community, along with young people from a hospital engagement group called Article 12. The result is a relaxed seating space featuring colourful artwork created with the well-being of staff and patients in mind. The White Leaf Centre is a purpose-built mental health facility in Aylesbury. Over 50 local artists worked with the OHAP to bring the buildings to life. Each room has a picture to brighten up the space, and 5 large-scale commissions help users navigate around the building. Artist Chris Tipping transforms the building from just a grey and white box into something so much more inviting. The artwork is based on the history and ecology of the site. It brings colour and nature directly into the building. Littlemore is a large mental health facility on the edge of Oxford. It has forensic services as well as other acute wards and community outreach services. The grounds around the hospital are being developed into therapeutic gardens and well-being areas. Service users, volunteers and partners have created and planted beautiful spaces that encourage wildlife. The educational art complements the space, featuring lots of animal and plant facts. For the OHAP to continue to deliver great service, it needs to grow and develop to meet the needs of a 21st century NHS. The Artist in Residence programme brings 8 freelance artists and volunteers into community hospitals in Oxfordshire. The Artist in Residence work leaves a long-lasting positive impact on the wards that reaches patients, families and staff. Conversations whilst creating art are different conversations. People share memories and stories, jokes, tears and laughter. The OHAP aims to actively engage and lead on research by supporting students and clinical staff research at all levels, and the team members continue to develop their own research at master's level alongside their roles.
colour enlivens life, whereas a hospital, things are rigid. And we want something which is beyond this, which stimulates us, taking you out of yourself. When you're in a hospital, you need taking out of yourself.